You're listening to The Social Workers on WCDB Albany.
Welcome to The Social Workers on WCDB Albany. My name is Eric Hardiman, and I'm here with Alyssa Lutmore, my co-host. Welcome back, Alyssa.
Hey, Eric. Great to be here.
We're happy to be here bringing you The Social Workers yet again on WCDB Albany. This is an important show for our community. It's an important show for the university. It's an important show for the School of Social Welfare, and more importantly, for the Albany area community. And so if you've just tuned in for the first time, The Social Workers is a live radio interview show where we talk to folks in the community who are providing social work services, who deal with social workers, who work in policy arenas, who work in community development, community organizing. We talk to people from all over, not just from the Albany area, but from all over the country and all over the world. And the idea is that Alyssa and I like to have these conversations and like to talk about the role of social work. And I don't know, do you want to say a little bit more about that, Alyssa?
Well, our whole idea is that the public is a client, and we try to reach individuals who might never have considered seeing or using a social worker, and to share resources and spread information about our profession, who we are, what we do. So I'm really excited about our guest today because, as you know, we've been going through this pandemic. So our three guests today are from Albany Medical Center, and they're social workers. So I'm excited to hear about their experience through this COVID-19 crisis. And I'll let you introduce them, Eric.
Sounds great. Let's get right into it. So we have three social workers with us here today, all from the Albany Medical Center. The first is Kevin O'Keefe. Kevin is a licensed social worker who graduated with his MSW in 2015 from the University at Albany. He's been working at Albany Med since August 2017. He's currently the social worker on the Medical Intensive Care Unit, where he works with the critical care team to provide families and patients with the support and guidance that they might need during a critical time. Hilary Charles, our second guest, is a licensed social worker who graduated also in 2015 with her MSW, although from Arizona State University. She's been working at Albany Medical Center since August 2018. And in her role as infectious disease medical social worker, Hilary assists patients by connecting them to resources within their communities and providing social and emotional support to parents and their patients and their families. Kathy Vasquez, finally, is a licensed clinical social worker who graduated with her MSW in 2017 from Hunter College in New York City. She's been working at Albany Medical Center since May 2018. She's currently the social worker on the medical unit, where she works with the interdisciplinary team to provide families and patients support and guidance through safe discharge planning. So we have three guests, and we're just going to have a free-ranging conversation. We really want to talk about medical social work and what it means to be a medical social worker. So Kevin, Hilary, and Kathy, welcome to the Social Workers.
Hi, thank you.
We're glad to have you here today.
We're really glad to be here. We're very excited to share our stories and talk about medical social work.
Now, I'm going to start off with the first question is COVID-19 has changed a lot of policies, and especially in the hospital setting, but can we back up to pre-COVID times? And can you talk a little bit about what a medical social worker does?
Yeah, so the medical social work, I think that's kind of like a, not negative connotation, but like their discharge planning. So when we talk to colleagues in the field, it's very much, well, I don't want to be a discharge planner. I want to do more than that. But I can tell you here at the Medical Center, which is a level 1 trauma center, so we get patients from all over regions. We get them from Vermont, Connecticut, Massachusetts, more rural, local places. We're really helping families navigate this very complex healthcare system. And part of that is in times of great trauma and crisis that families may not experience. We talk about like a lay person, not every person has been admitted to the hospital, and not every person knows a person who's been admitted to the hospital necessarily. So the language we use in the hospital world and the healthcare world can be very confusing, overwhelming, and then you add a time of uncertainty, sometimes unfortunately end of life and crises. So a social worker's role in that is helping families and patients to navigate that, learn the terminology, be able to communicate with the doctors. Kind of also on the flip side of that is the doctors helping communicate to the families these complex decisions and helping them go through this new life change. If they leave the hospital, sometimes they need to go to rehab or a long-term placement or facility far away. And so helping the families with the emotional piece of that is really kind of our crux of before the crisis happened.
And how, I mean, it seems like you had a full plate to begin with a lot of issues, a lot of people coming in for different reasons in hospitals and serving them and making sure they're connected with the right resources. So what was this transition like when COVID-19 hit and you're getting probably new policies and procedures and a change in cases? What was this like for you guys?
I think this is Hilary. I think it was a shock initially just to kind of see the overnight transformation. My unit is infectious disease. So prior to that, we've always been familiar with PPE and people on contact precautions for various reasons. But just to see our very first COVID patient was actually on airborne precautions, which means that the nurse, it was on a one-to-one, so the only nurse could go into the room, and they had to kind of wear almost like a hazmat suit just to go into the room. So just physically seeing the change that the unit had overnight was also it was just kind of surprising. Did you add anything?
Hilary, that, it's really fascinating to hear, that you're working on the infectious disease unit at a time like this when infectious disease and the virus and the pandemic has become so widespread globally. And so the very issues that your unit typically works on prior to the pandemic have now become, I don't want to say commonplace, but have become so widespread that I would imagine the level, the quantity of work that your unit has had to provide has probably increased tenfold, if not more.
Yes, I would definitely agree with that. We all kind of had to learn very quickly what COVID is and how it impacts, all organs and all different parts of the body, as well as how are we keeping patients and families safe while they're in the hospital, as well as once they go back into the community. And so that was something that I was uniquely able to assist with, just in terms of helping keep our patients once they discharge the hospital, if they are positive for COVID, making sure that they have access to all of the resources that they need, including medications, food, and other supplies once they go home.
It's incredible work that you're doing. I guess, Kathy, maybe I'd like to hear from you a little bit and sort of what has your experience been like through this pandemic?
Well, I really was grateful for a lot of what Hilary's unit has begun, because I consider them really to be the trailblazers through this pandemic for our hospital. I was on a unit that primarily previously was a surgical unit, and then switched over and changed to a unit that was going to accept a lot of the patients, COVID positive patients or pending, from downstate New York, so Westchester County, New York City area. And the field obviously was something that was new to myself and to a lot of the staff as well, because infectious disease was not primarily our area of expertise or specialty. So Hilary's unit very much helped us get acclimated in terms of what would be a proper, precautionary measures, what best practices have they used that they found that were useful and were very effective. Very helpful in terms of adjusting to that change for myself and the unit that I was on.
And I like how you mentioned that the units have to work together, because there was no one unit that kind of was by itself. You all had to work together to make sure that the clients and the patients and their families had the right services that they needed and were connected to the right resources. So it's a really a collaboration among all the units at Albany Med to make sure that everything is being handled in a way that's clear to the clients, as smooth as you can transition.
Mm-hmm. Yeah, Alyssa, if you don't mind, I wanted to emphasize that. So I'm on the ICU, so we were at the highest level of care at the hospital, and Kathy and Hilary were considered medical floors. So we were talking yesterday and really during the COVID that we saw a lot of patients almost together. So we're stationed on our own unit. We are unit-based in this hospital. That's our model. We work with nurse case managers as well, but we saw so many patients with the prognosis of the disease that 1 minute it would be a medical floor patient and the next it would be on the ICU. Some people we were able to get back to the medical ICU, and sometimes they had to bounce back a couple of times. But Kathy and Hilary and I we have a handful of patients that we all interacted with at one point. So it's really fascinating to see the continuum of the hospital stay and the successes and the family stories.
It's interesting. And I would imagine too, Kevin, that, as we've learned more about COVID-19, one of the things that's been really fascinating as someone who's not in the medical arena is watching the public information about this disease change. And so when we watch the news, we learn new things every day about it, about what type of disease it is. Scientists are learning more, and we're figuring it out. And so I wonder if any of the three of you could talk a little bit about what that's been like working. You're essentially working on the front lines of the healthcare system with persons impacted by this illness, but we don't fully know everything about this illness yet, and the information changes every day. So what is that like?
I would say the biggest change specifically with COVID has been the increase in our communication with epidemiology. Because this virus was so new, there's a lot that going into it we didn't know. So we really relied on our epidemiology department here at Albany Med to support us through that and give us guidance about best practices.
And
I think, Eric,
go ahead, Kevin.
Sorry, just to add to what Hilary was saying was sometimes we found out information through the news as well, right, of what the clinical trial kind of medicine we could use. And, that's obviously not our expertise, but I remember doctors on the ICU being like, okay, this drug was approved, like, let's do it. And families sometimes would initiate that conversation because obviously in the hospital, we don't have access to the news source during our shifts. And families would be like, I just saw so-and-so, on whatever channel, can my loved one get that? What are you guys doing in terms of that? And we would have to the doctors would really have to assess that and in the moment and say, okay, and they did their trials and studies and got the approval, but it was very fascinating to see, usually for the most part, doctors know the prognosis and how it affects people. And this was just, things were changing at such a rapid pace, I would say hour to hour, sometimes minutes to minutes of patient conditions. And that's why they would sometimes bounce from the ICU to the medical floor in a couple of days because it was just so unknown and how to treat it.
And is there a lot of interaction between the hospital and the public health department, the health department in New York State? Like, is that?
So to that question, we did have, I think overnight, as we kind of indicated, overnight, our jobs kind of shifted, right? So with the Department of Health, as soon as we got our first COVID case, that automatically meant we were reaching out to counties. So we didn't work necessarily at the state level. We were more so working at the county level. So working with Albany County Department of Health is probably the biggest department that we worked with just in terms of daily phone calls. Anytime that I discharged a patient, I was calling them just to let them know where they were going home, making sure that they had the correct address, helping them identify other family in the house or who else was in the home, just so that they could continue to track our positive patients.
And to add to that, a lot of the County Department of Health also assisted in the discharge planning for some of our patients as well. So when we were trying to troubleshoot some areas in terms of maybe housing or accessibility to medications or food, a lot of the Department of Health counties really helped us in that, troubleshoot those areas and, try to come up with a best fit plan.
They were also sometimes aware of resources, so they would let us know about those as well.
No, I have a question when you're talking about discharge planning and working for Albany Med, and correct me if I'm wrong, you received patients from New York City, which was the epicenter of this whole crisis, to help with numbers down there. Am I correct? That patients.
Yeah.
So how was that? Did they have other social workers from New York City working to help, or was those considered part of your caseload? And how was that working with individuals who aren't even maybe from the Albany area or the capital region and trying to do discharge planning and connecting them with resources that might not even be local?
Correct. That was a huge learning curve, especially for my unit. And for everybody, because as Kevin mentioned, any patient that we would have, and if they would transition to another unit, he would also, see the same sort of barriers potentially. But it was difficult. I mean, we still had to have patients that even came in from other areas would still come with specific needs. So when we were, troubleshooting some discharge planning in terms of if a patient needed rehabilitation, or if they needed visiting nurse service. It was a lot of trying to work with the families as well as with the patient to see if they had any idea or any knowledge in terms of agencies or rehabs that they would recommend us to exploring. And I think that's where we relied on them more heavily in that aspect, just because sometimes the families would have an idea, oh, can we explore this facility or can we do that? And then after identifying what would work best for them based on their preference, the process was pretty much similar to that extent.
But that's something that's so new. But social workers are used to, providing that extensive emotional support, enhanced communication, and care planning for families. So when you're still learning too, because everything shifted about new resources in different locations, and the information on the news is changing about what treatments are working or what happens next about this virus, it must have been an interesting situation for you as you're learning as you go as well.
Yeah.
Yeah, absolutely.
Oh, yeah. I was just going to add to that. I think it was helpful, to have social workers, and just to emphasize, we were asked to stay in the hospital on our unit.
Mm-hmm.
And I think because we were asked to stay, that shows the value of our role, particularly with providing emotional support to families. I remember very specifically some of the first patients I got, their families were asking me questions like, well, shouldn't the patient be quarantined in the hospital? And so, we had to kind of educate them on that, talking through that no, the safest place for families and patients who are positive for COVID is actually at home, and talking about reasons why. And so I think having us here on site on the unit assisted in that process.
Mm-hmm. If you don't mind, I want to just add to that too, because we got New York City people in one day. I think it was 2 waves. I don't have the numbers. I wasn't able to find the numbers, but before we even talked about what the discharge plan looked like, it was notifying family members that their loved ones were up here. I remember very discreetly and so vividly that I called a family and I said, oh, I'm from Albany Med. I'm here to notify you that your loved one is up here. And they said, oh my goodness, I didn't realize. The hospital down there didn't tell us, and I didn't know. I talked to the patient last night, and he said, I remember them saying, oh, I'm going in a helicopter. They're going to put me somewhere where they can take better care of me. And the family member said, I thought he was confused. And I said, no, that did happen. And so really before the discharge plans and finding resources in New York City, it was just telling families, they're up here. We have them. You can trust us with our care. And to do that at a very acute level, at a high volume level, we talk about building rapport in social work. I always say medical social work is building rapport in about 5 minutes and getting a family or a patient to trust you in about 5 minutes because of the acuity.
So Kevin, that brings up a really interesting point that I wanted to ask each of the 3 of you. And let me just remind listeners, if you're just tuning in, this is the Social Workers Live Radio Talk Show, and we've got 3 guests with us today, Kevin O'Keefe, Hilary Charles, and Kathy Vasquez. Kevin, Hilary, and Kathy are all medical social workers at the Albany Medical Center here in Albany, New York. And so I wanted to ask each of you, as you were talking about some of the rapidly changing information, talking with families, developing rapport with families in 5 minutes. Each of you has been in the medical field for a couple years, for various lengths, 2 to 4 years. And so I think, you each have some experience in what medical social work is like pre-pandemic. However, things have accelerated and the rate of new information, the rate of new challenge, new tasks at work are probably, I would imagine, changing daily. And I think there's also a very personal element to this too, which is that for each of you being on the front lines of this work, while it's critically important, it also necessitates a personal decision, in terms of your own personal safety and your own personal comfort going into a workplace where you are at higher risk than, say, folks who are able to work from home and don't have to be physically present and can work remotely. So I wonder if each of you could talk a little bit about what that personal decision has been like for you and how you've coped with some of those challenges in your own work.
That's a good question.
Yeah, that's a heavy question. Well, I'll just start. I mean, I think for me, just seeing the physical change of the unit overnight, it was scary. To be honest, it was scary at first to kind of just see, this is a virus we know nothing about at first, and just to see, how we're hearing a lot of news in the media, how the virus is being spread. So personally, you had to make a decision of, how are we going to best support our patients and our families, and we have a job to do at the end of the day. So I think seeing the way I did at first want to step away, but seeing the role that social workers were able to play and seeing the value of my role specifically in helping assist the nurses made me more motivated to want to stay on my unit.
Great.
Yeah, I would definitely echo that same statement that Hilary made, that it was scary, obviously, especially in the beginning, and not really knowing, what would be the, proper way to go about things or approach, what to say at that point, just because everything was just ever changing. I don't think I've used hand sanitizer more than I have during this time than any other moment while working here. But, I think the collaboration really was a huge motivating factor to continue to do the work that we do day in and day out, especially to help families that, with the visitor restriction are unable to personally and physically be here by their family member's side. It really showed how much our role in that is just so vital in helping them, navigate this time of uncertainty. So that was really motivating for me in terms of just continuing to come, day after day, and then having, medical staff or any other staff on our unit just say like, well, what do we do? What can we do to help these patients? So that was really helpful.
How about you, Kevin?
Yeah, for me, it was, I'll tell you, a lot of the doctors had colleagues overseas and kind of had this really dark forecast of what was going to happen. And we really planned for really worst case scenario of a lot of patients that overwhelmed the hospital. And luckily we didn't hit that mark. But for me, I spoke to one of the doctors who I'm pretty close with on the ICU. And he said to me, I want you to know how important you guys are in all of this. And he said, we can treat patients as much as we can, but if they don't have a place to go and they're not getting the communication that they need, then all of our treatment would be essentially for nothing. And so that really motivated me and really inspired me to say like, wow, like we are here. The hospital is asking us to be here when they sent a lot of other professions home and to work from home because we have a skill set and we can do this. We are on the front lines with the nurses and everything. So I always said on a typical day pre-COVID and sometimes now, I always say the hospital can be a very sad and dark place, but when you walk out, it's happy and sunny and things aren't so dire there. And but during COVID, sometimes what I was hearing on the news was sitting right in front of me. And it was really kind of transcended my own personal viewpoint and said, wow, this could be happening in Italy, in China, in all over the world. And I know we talk about the globalization of social work, and it felt very much above me to be there and to talk to this family and say, wow, this is happening all over the world. And it motivated me. It also burnt me out sometimes. I'll tell you, I think it was a lot to handle and a lot to be put on. And sometimes it didn't feel like we had a choice. And if, it was like, well, I would like to stay home. I know there was talk in the beginning of like, are they going to send us home? Are they going to send us home? And there was, our director was very, very adamant of, no, we should be here. We should be with the doctors, and we should be with the nurses and everyone, because we have a very important role. So it was a roller coaster for me, but coming out of it from the other side and talking about it here on the radio station too, it's been very helpful of saying like, wow, we did it. We came out from the first crisis on the other side. And I think we'll be more prepared if, a second wave hits and such.
And listening to you, Kevin, it sort of reminds me that this type of work that social workers, and not just social workers, but folks in the medical field, the medical area, or the type of work that they're engaged in takes an emotional toll, and it's not easy work. It's incredibly challenging work. And so I wonder if any or each of the three of you could talk a little bit about how, what sort of resources are in place for you to take care of yourselves, and what sorts of things have you found yourself doing to make sure that you maintain care of yourself throughout all of this?
So I'll start. Albany Med has provided an employee assistance program for that. So we do get, there's resources through that. Again, us coming together and having this conversation, we kind of talked yesterday, the three of us, and that was really helpful to say like, wow, kind of like a little debrief and everything. Our supervisors have been very available if we need to talk. I think at one point I was seeing my supervisor every day being like, can I do this? Can I do this? For me, it's been a struggle because I'm a very active person. So I like to work out. I do yoga, I play volleyball. And so for all of that to be gone all of a sudden, and then to have this heightened like burnout and like, heightened emotion, it was hard. So I did the best I could. I think I kind of went in autopilot a little bit and just said, okay, when on the other side, we'll figure out how to, do that. But I think the support of our colleagues and the profession and my family at home was super, super important.
Mm-hmm. I think at one point we even had like daily like phone check-ins with our manager.
Yeah.
Mm-hmm. They would set up a WebEx meeting just to touch base and also, disperse any updated information throughout what's going on in the hospital in terms of COVID. But for myself, I personally, I just couldn't watch the news at home. I just shut it off. My family, all of them had to, were able to work from home, thankfully. And for me, it was just, making sure that I just detached myself from any updated information regarding COVID on the news in order for my own pretty much sanity, just so that, I can just maintain focus on what I had to do here.
Yeah.
Well, you guys have described. Go ahead.
So, just very quickly. So for me, I think one of the things was to find moments of joy in my personal life. So I really enjoyed coloring. So I used to do that when I go home. I also have amazing friends that I would talk to them kind of just about my day. And I also have a very supportive family as well.
Well, you need those resources. Social work talks so much about self-care, and this was a perfect example of where you have to care for yourself so you can do your job and help others. Because you guys are essential workers. Social workers are essential workers, and what you described today shows that, how you had to really be able to provide the service that was needed to these families as they came in and out of the hospital, and the patients, to help navigate, provide that emotional support, that communication to them so they understood what was going on, and then to make sure they were connected with the right resources upon discharge. And I really just want to say thank you to you guys for, I'm sure it's been a roller coaster of the past few months, and you guys have really done an amazing job at helping individuals through this time.
Thank you.
Thank you.
Yeah, and I just wanted to ask us a last quick question here. Maybe not a quick question, but as a last question, and I hope this is okay, Alyssa.
Of course.
that it really strikes me in listening to you, as Alyssa said, the work you're doing is so important, and we thank you so much for, certainly for all the work that you're doing on behalf of the patients, on behalf of the community, but also on behalf of the social work profession, and showing others what social workers can and should be doing in a time like this. But it also strikes me that we are living through history every day right now. And all that's going on with the pandemic is part of that. All that's going on with the murder of George Floyd and the unrest that's followed that, with the empowerment of a population to suddenly find a voice and becoming activists, and with communities learning how to listen to people in their communities. And there's just so much going on historically right now, every day in this country, that it really strikes me that folks like yourself, who are social workers on the front lines, are part of that history. And you're working in a profession at a time when everything is changing so rapidly. And I think it's going to be really, this is maybe less of a question than an observation, but it's going to be really interesting a year from now to look back on this, all of it, politically, socially, culturally, the healthcare system, the police system, all of the institutions of community care that we have in our society, to look back and say, how has social work changed? How has social work responded? And so I guess if I could phrase it into a question, have you thought about, or are you able to think about a little bit how social work might be changing as a result of this pandemic? And what do you think some of the outcomes on the other side might be? Will medical social work take on a different role post-pandemic? Will social work in general take on a different role post-pandemic? And so I guess I just wanted to hear some of your thoughts on that.
Yeah, I think, thank you for the question. I think for medical inpatient social work, I think it just validated what we do every day and then kind of gave it a national spotlight. I'll tell you, I was in mental health and substance abuse before this, and if you asked me at graduation 5 years ago, do you want to be a medical social worker, Kevin? I'd say, oh no, not interested in me. So I think I would like to invite other social workers to really understand medical social work, particularly inpatient, because it is the most fascinating thing I have done in my whole life. And to be a part of this crisis and the global national level of it just really reaffirms that of, wow, we social workers in hospitals are so important, and it's so rewarding, and at times it's sad and frustrating, but I mean, it's such a fascinating field that we're going to need more really strong social workers to come and help us so we can continue to, improve communication, advocate for the patients, help the doctors, help the nurses. So I think we're going to need more. I think that's going to happen on the other side.
I'd just like to add to what Kevin said. I would agree with that sentiment. I would say that, if anything, the role of social workers is expanding. Now more than ever, we need social workers to help people navigate these tough systems, to help people get access to resources that are available in the community. And that is actually probably my favorite thing about being a social worker, is being able to connect people to resources. So I think that if I had to guess, I would say that in the future, I would see the role of social workers becoming more significant.
Mm-hmm. And I think too, it's during this time, it highlighted just all of the skill sets that we bring as social workers to the medical field. Mm-hmm. We may not be able to be a part of the patient and their family's lives for a long or extended period of time, but we definitely are part of their lives for brief, pivotal turning point moments in their lives. Mm-hmm. And really to provide them the emotional support, to explore different options that are available to them, is really, vital for them in terms of easing as much as possible that transition.
I couldn't agree more with everything that you said. And I'm really thrilled that I shouldn't say thrilled, but I'm glad that people are recognizing the general public and the media, and have been hearing more and more about how social workers have been such a critical role during this whole time, whether it's medical social workers, school social workers, all these different areas where social workers have been called upon to help individuals in the community, to connect them with resources, to make sure that they are getting what they need during this time where we've been social distancing and haven't had a lot of the supports that we are used to. So I think this is a really important time for the social work profession, and what you've talked about today really showed that. And I want to thank you again for all the work that you've been doing.
So you've been listening to an interview with Kevin O'Keefe, Hilary Charles, and Kathy Vasquez. Kevin, Hilary, and Kathy are all licensed social workers at the Albany Medical Center, where they work in various units at Albany Medical Center, and they are on the front lines of providing healthcare during the COVID-19 pandemic. Thank you once again so much for being on our show, and we hope you'll come back and talk to us in a few months and let us know how it continues to go.
Yeah, thank you. We'd love that.
So you've been listening to the social workers on WCDB Albany, and Alyssa, maybe if you could, as usual, provide listeners with some information on where they can find old episodes, where they can tune in, where they can find out more about our show.
Yep. So we are available. We're on WCDB, and we are also via podcast. So we are on iTunes. We're on social media where you can find a lot of our episodes. Our handle is @SocialWorkersFM. And you can also download all episodes of our show, past episodes, at the socialworkersradiotalkshow.simplecast.com.
And if you're a social worker out there, or if you've interacted with a social worker, if you're thinking about social worker, certainly feel free to get in touch with us. We'd love to talk to you. We'd love to interview you on the air. We'd like to keep the show going and keep it relevant in this particular time. We think it's more important than ever to continue the conversation about social work and its importance in the community. So we will keep the social workers alive and well here on the radio. So thank you for listening to the social workers on WCDB Albany.
You're listening to the social workers on WCDB Albany.